My name's Dr. Christopher Orton. I'm a consultant respiratory physician at Welbeck, and we're going to discuss some of the commonly asked questions that patients have for us regarding COPD. So what is COPD, or chronic obstructive pulmonary disease? COPD is a chronic respiratory condition typified by breathlessness, wheeze, cough and sputum productivity. What causes COPD? COPD is caused by chronic inhalation or lung injury, which in this country mostly equates to cigarette smoke exposure. It's typically the duration of smoking as well as the intensity, so patients that have smoked 10 or 20 cigarettes a day for short periods usually won't go on to suffer such a condition. However, even if you smoked only 10 or so, but for a much longer period, say 40 years, that's when the disease starts to accumulate in the airways and also the gas exchange tissues of the lung. COPD can occur for any patient over 35, but most sufferers are diagnosed later on in life, in their 50s or 60s. Often patients have preceding asthma, and what can be noted is that they're losing that reversibility. That response to the inhalers is becoming less favourable. How long does COPD last? COPD is a chronic condition for which there is unfortunately no cure. Sufferers of the condition will develop progressive symptoms that also coincide with the natural ageing of the lung, which occurs for people over the age of 30. When treating a patient with COPD, I think it's important to take a really pragmatic approach. Yes, inhalers, and the right inhaler, can be beneficial in reversing some of the airways obstruction, that flow limitation that we see on the lung function testing. But that's only part of the picture. We also need to think about trying to help patients clear phlegm, trying to reduce the impact of cough through targeted medications, and also look at some of the other systemic effects that can occur for any patient who has smoked for a considerable period of their life. Pulmonary rehabilitation is absolutely fundamental for any patient with COPD. And even if the exercise classes available in your local area aren't suitable, then all patients should be looking to push themselves to breathlessness 3 times a week and conduct a graded and incremental exercise program as able. The most important consideration for any patient diagnosed with COPD is to stop further injury to the lungs by quitting smoking. What should I expect on a visit to Welbeck? So all patients will undergo an initial consultation, and a tailored package of tests will be selected to make sure that we're able to fully characterise the lung condition that you have. We would look to perform blood tests, sputum, lung function, a CT scan of the thorax as needed to try and help us understand what type of lung condition or type of COPD it is that you suffer and how best to help you with this. If you are concerned, then please visit our website for more information or to book a consultation.